Eating disorders are disorders that are not only focused on food, but they're also commonly focused on issues of weight and body image as well. One of the most well-known eating disorders is anorexia, or anorexia nervosa. An anorexia is an eating disorder where a person maintains a starvation diet despite being already significantly underweight, typically about 15% below normal body weight. But despite this, individuals with anorexia feel that they are overweight, and they become obsessed with continuing to lose even more weight. So you have an obsession with weight loss. And individuals with this disorder, they tend to fast, or they tend to consume far fewer calories during the day than is typically recommended. And about 50% of individuals with this disorder also use binging and purging, so eating food and then trying to get rid of it by throwing up, in order to help them lose weight. And I'm going to put that down here as B and P so that I don't have to keep writing it out. Another fairly well-known eating disorder is bulimia nervosa, or just bulimia. And this is an eating disorder where a person alternates between binge eating and purging. So here we also have a binging and purging behavior. So these individuals will gorge on unhealthy foods, they'll tend to overeat, and then they'll feel guilty about this behavior, and so they'll try to get rid of this food, either by vomiting or using laxatives. In addition to those purging behaviors, some individuals will also intensely exercise as a way to get rid of body fat, or as another way to purge. So just to make this clear, let's write down overeat and then purge. And rather than having an obsession with weight loss per se, individuals with bulimia usually have an intense fear of being overweight. So we have an obsession with weight gain. And they can also show an obsession with food or have extreme cravings. And I want to spend some time thinking about the differences between these two disorders, because for years I thought that anorexia described cases where individuals starved themselves to lose weight, while bulimia was cases where people purged or vomited in order to lose weight. But that isn't actually the distinction between the two of them. Anorexia is marked by individuals being significantly underweight, but bulimia is actually marked by weight fluctuations. And so rather than lose a lot of weight, individuals with bulimia tend to remain at or above normal body weight, which actually makes bulimia much easier to hide. Another eating disorder that's not talked about as much as the other two is binge eating disorder. And this is categorized by the same binging behavior that we see in both anorexia as well as bulimia, but in this case, there is no purging behavior. Individuals with this disorder tend to have really intense cravings, and in response to them, they'll sometimes sit down and overeat in a very short period of time. And possibly related to all of these disorders is another disorder, which is called body dysmorphic disorder. Which is where individuals become overly concerned with their body image and tend to become obsessed with every single perceived body flaw. And as a result, they tend to have a really negative and exaggerated idea about what their body looks like. And it's easy to see how this kind of really intense negative body image could result in eating disorders. What population do eating disorders affect? One population is women, and eating disorders are far more common in women than they are in men. In fact, 9 out of 10 individuals who have anorexia are female. In general, though, looking at the entire population, it seems that there's 0.6% of people will develop anorexia or exhibit anorexic behaviors at some point in their life. 1% will develop bulimia, and a much higher 2.8% for binge eating disorders. What sorts of things might cause eating disorders? Well, while there might be some kind of genetic predisposition, this is one case where we know that there are a lot of environmental triggers. For example, some research has shown that individuals who have mothers that are incredibly focused on both their own weight and their child's weight tend to develop eating disorders. Research has also shown that individuals with childhood obesity tend to be at risk for bulimia, while individuals who come from really competitive and high-achieving families are more likely to develop anorexia. And another cause, one that's talked about in the media a lot, which I guess is a subset of the environment, is culture. And this is usually talked about when we talk about gender, specifically the fact that women are constantly being exposed to this ideal thinness that's really unachievable. And there's been some research that has indicated that these unrealistic expectations might lead to body dysmorphic disorder or one of these eating disorders. And so far, I think a lot of the research on eating disorders has focused on these environmental triggers or has focused on how culture can maybe increase the tendency for people to have this disorder. But as I mentioned before, we do know that there is some genetic influence, in that research has shown that there is an increased likelihood that identical twins will share eating disorders as compared to fraternal twins. So let's think about this a bit. We know that identical twins share 100% of genes, while fraternal twins share 50%. And in this case, we're talking about identical twins who have grown up in the same house with the same family, and the same as fraternal twins. So in this case, if we find that the prevalence of eating disorders is more common for identical twins than fraternal twins, it indicates that genes might be driving it, since the identical twins share 100% of their genetic material. There are also many personality traits that tend to go along with eating disorders. For example, people with low self-evaluation or perfectionist standards, people who have a lot of concerns about what others think about them. These traits are all typically present in individuals who have eating disorders. However, it's hard to draw any conclusions about these assumptions, since it's hard to know whether or not some of these concerns lead to eating disorders, or whether or not people with eating disorders tend to develop low self-evaluation over time.